Welcome to Future Minority Dentists Club on Clubhouse. This is Paula Benefo, a rising D1 at UCSF. Today's discussion will be basically talking about tips on chairside manner for dental school and in the field of dentistry as well. And I've also invited Dr. Hardy and Dr. Marie also want to contribute to this discussion. So those will be the ones really leading this discussion. We're just here to listen and learn, and I'm excited on the direction that all of our new moderators will be taking for today's discussion. Just as, I guess, some housekeeping rules, we've had, I guess, some people raise their hand and it's kind of trolls. So I would say, moderators, please be aware of that. If you notice that there's nothing in their bio that really would discern that they are interested in dentistry, do not bring them on stage because we've had an incident where there's just like moaning. Another housekeeping is if you click on the greenhouse on the upper right, next to our former name, Black Dental Students and Predents, you'll see that on our description page, we have included all of our April events. So after today's event, you'll see we have every Wednesday we have just dentists supporting dental students and predents. So that's a discussion that's coming on this Wednesday, and then on Friday we will be having a business discussion led by Dr. Jeter. So we are just excited for this week and happy April. And I'm going to turn it over to Dr. Walt to take over this room. Thank you.
How's everybody doing this evening? Thank you guys for having me, having everybody that's on stage right now. You know, when they asked me to talk about chairside manners, I was kind of confused because, for us, it's more of an interaction with patients. I'm not sure if it's manners because everybody's manners are a little different. But, to me, it's just how do you interact with patients to get the most productive outcome, right? And so there's four things that patients kind of have to deal with, or what you have to deal with when it comes to patients. The first thing is fear. Patients are very afraid of us. They tell us that every time they come in, right? Oh, I'd rather be somewhere else besides the dentist. Okay, I get it. Okay, that's the first thing they always tell you. And then they talk about finance. Oh, well, I bet my treatment is paying for your nice car or house or whatever it may be. And no, it's not. But, that's something that they believe, right? And that's something that you have to kind of fight. There's so many things you have to fight when it comes to patients. They're also talking about, if you graduate from dental school, they're talking about how young you are. Oh, are you old enough to be my dentist? I got that many times when I first graduated. Are you old enough to be my dentist? When I was at the VA hospital, are you old enough to be my dentist? Should I get somebody else? So these are things that you guys have to understand from the get-go. You're fighting. You're going to be dealing with this a lot. And I bet you all the other doctors are going to talk about this as well. So tonight, I wanted to just basically go through the whole scenario and explain to you guys how do you combat issues such as age, such as patients thinking that their treatment plan costs so much, but yet they have an iPhone in their hand, which costs $1,200. We won't get on that. But these are things that we're going to talk about, right? There's so many things that patients don't find to be important that are important, right? I remember one time I had a discussion with somebody who sold time homes or timeshares properties, and after we talked for a while, he basically asked me a question which stuck with me for a very long time. He was like, how come dentists have such a hard time convincing people to do something that's actually good for them, while I can convince somebody to get something that they don't really need, they want but they don't need? But yet dentists have such a hard time getting people to do something and actually believe in something that's actually beneficial for them. So again, these are things that we're going to have a discussion about. And anytime anybody has a question, just please raise your hand, come up and ask the question. I don't want it to be a lecture. You guys are going to get more than enough lectures in your life. I promise you on that. I just want to make sure that we have a productive conversation. We talk about what's important, and we just have fun with this. I don't know how long we're going to be doing this for, an hour or two, but I want to make sure that everybody gets their questions asked. I want to make sure that people understand that this is supposed to be something that you take something away from. We can role play. We can talk about how do we convince patients to accept your treatment plan? How do we get patients to understand that you're there to help them? How do we go through this whole issue with COVID, right? Because COVID has really prevented us from interacting with patients the way we used to. Before you would come in and they would see the smile on your face. So they would see, okay, we got someone that's a little warm, someone that wants to help me. Now you come in with a mask and goggles and so forth. They don't really see your face. So how do we combat that? How do we get through that? How do we make sure that your personality stands out? That's a lot of stuff that we're going to cover tonight. So what I'm going to do is I'm just going to ask questions, and I'm going to just try to get people to really interact. So, Dr. Hardy, I'm going to start with you. Tell me the hardest thing you've had to deal with when it comes to dealing with kids. A lot of general dentists don't want to deal with kids for that reason, right? They're tough, they're difficult, they cry, parents, parents. So please tell me what you've actually encountered that would help some of these pre-dent and dental students understand what to look for when it comes to interacting with kids and parents.
Thank you, Walter. And hello, everyone. Good evening. I'm Dr. Hardy, and like Dr. Aka said, I am a pediatric dentist. And I would say something that's big for us is definitely your chairside manner extends beyond your patient. Especially in pediatrics, because a lot of times you have to have chairside manner when it comes to the pediatric patient, but also with their parent. And that rapport and that relationship you build with the parent can a lot of times determine how they trust you with their child, and can usually extend to, what the child is comfortable with as well. So I would say the main difference for pedo is that you have to deal with both the child as chairside manner as well as the parent. Of course, a lot of it does have to do with personality, especially in pediatrics. Kids want to feel warm and welcome and safe. And they also want to feel heard. This goes for both the children and the parent. They want to know that you're not just going to take their child into the room, do whatever you want to do, and the parent doesn't know what's going on. So I feel like the one thing that has been the most beneficial for me in improving my chairside manner over the years has been making sure that both the patient and the parent feel very well informed. So I would definitely say sometimes you can overshare with kids, but a lot of times with the parent, the better you explain things, even the small things that you think, okay, maybe they don't need to know, it's a lot easier if you just try to explain it, at least in layman's terms in the beginning. So that way it's a little bit easier for them to get it in general. But I would definitely say being informative is the main thing when it comes to kids and adults for sure.
What do you do with parents that aren't making the situation any better? So imagine if a kid is crying, they're like bawling their eyes out, and the parents are like, you better sit down before this, and this. And I'm speaking for mostly African parents. They don't care who's around. They'll basically make sure that they're heard. So how do you deal with parents that are making the situation worse?
Um, yeah, so every day they do this, but I would definitely say once parents trust you, even when they're getting nervous and anxious and, a little bit more overwhelmed with the situation, if they trust you, it's easier to calm them. So that's the first thing. The second thing would be you have to make sure that you always remain calm and you always have a certain level of you know what you're doing and you know what's going on, and you're more in control of the situation. Because a lot of times parents they'll try to overtalk you, and I allow them to have their time, but I never get loud with any of them. If they're getting excited and overwhelmed, I go the exact opposite. It's better to calm down the situation, even if they're stressed out. Because a lot of times, especially with pediatrics, you're dealing with parents of special needs patients or families that have young kids. And this can be really overwhelming. So it's understandable that they may be stressed. So I try to make sure that I just tone the whole tone of the conversation down in the way that I deliver my part of the conversation. Because I can't control how they're going to react, but I can control how I react. And a lot of times that will de escalate something because nobody really wants to be yelling by themselves. And then also telling them, I've had parents yelling, sometimes they want to yell in your face, because they don't like or understand what's going on, or you've explained something to them 100 times, but now when they come back and it's actually time for the procedure, they're upset because they're confused, or you talk to the mom and not to the dad, but now dad is here. So really making sure you get into a systemic routine of re-informing them of what's going on, asking them if they have any questions, like continuously, and then making sure you still have control over your emotions. Because once you start getting upset and flustered and frustrated just because they are, it that is going to reflect back in your tone, and it just continues to escalate the situation. So a lot of times I end up kind of being that overly just chill, like, okay, mom, well, I understand this is upsetting. This is what we can do. Because the other thing is, you never want to have it to where you don't know what you would do in the scenario. So, for instance, if a parent is upset about a treatment plan, or upset about, how something turned out with the treatment plan that you gave, you always present them with other options. And then once you leave the option up to the parent, they have no choice but to make the decision on their own. So a lot of times I present my treatment plan as, from a professional standpoint, this is what I would do, and this is what I suggest, but these are also your options. And also, this is if you decide to do nothing. Because a lot of times as dentists, we get into the habit of thinking, I've got to treat, this is what has to be done. But, no treatment is also an option. There are consequences, but it's an option. And usually once I give them that option and keep my tone level and put the ball in their court, they have no decision but to kind of tone it down.
All right. So, Dr. Jackson, whenever we go to dental school, we learn a lot, right? We learn a whole new language. We learn first molar, second molar. We learn how to identify teeth by positions like, buccal, lingual, so forth, right? We learn different terminologies, pathologies and stuff, but patients don't learn that. How do you make sure that the patient understands what you're talking about in the simplest form without feeling overwhelmed that you're basically talking over them? Because no one wants to feel dumb, right? When I go to get my car fixed, I don't want the mechanic basically talking down on me. So how do you make sure that you explain procedures to patients, but yet in a manner that's going to allow them to understand what you're saying?
Hello, guys. Okay, so I like this question. So I am a big proponent of making sure you always use layman's terms. Remember things that you knew before you were in dentistry. You didn't know what buccal meant. You can say the outside surface, the tongue surface for lingual, the biting surface. That's something that's universally understood. The other thing is I'm a very big fan of models. So years ago, when I first purchased my practice, I went on eBay and bought all types of models. And nowadays you can buy them on Amazon, eBay, wherever. You'll see models that show what a crown is, what a bridge is, what a partial is, how implants work, periodontal disease, all types of things. So I literally will pull these models out. I have sets in each operatory, and I show this to patients. I also make sure I explain before I do. I guess I pulled it from PEDS with the tell, show, do. I say, just before I start, I greet the patient, say hello. Oh, hi, Mr. Joe Schmo. Today we're going to be doing a tooth color filling on that back tooth on your lower right. Those are all terms anyone can understand. I'm not going to say we're doing an occlusal composite on number 30 because that's nonsense to most people out there. When I'm doing exam and I'm calling things out to the hygienist or assistant, I tell them, hey, you're going to hear me calling some things out. Just so you know, we're just marking everything we see in your mouth, especially if they're a new patient. I'm marking fillings, positions of teeth, so it's going to sound kind of crazy, just so she can mark all these things down. The other thing I'm big on is when I'm doing periodontal probing, I say you're going to hear, me, maybe it's a hygienist, but I have the hygienist trained to say the same thing. You're going to hear me calling out some numbers. Just so you know what you're hearing, I want you to know what they mean. 1, 2, and 3 are small, healthy spaces between your gums and your teeth, and I show them on like a picture or on a model where that space is. Then I say that's a healthy space that you can clean with floss or a toothbrush. 4 and 5 are problem areas that need attention with deep cleaning or, more attention with your brushing, whatever it may be, depending on that situation. 6 and above are big problem areas, and I'm going to make sure if that's the case, I'm going to send you over to Dr. Walt, that type of thing. So I try to break everything down. I show it with models, and I always ask them before when I'm done closing out, whether it's procedure, treatment planning type of thing, do you have any questions? Always ask that.
On the same, and I'm going to actually just piggyback a little bit. So if she sends the patient to me and they have 5, 6, 7 millimeter pockets or greater, they need surgery called osseous surgery. The way I explain to patients what that is, in the same way, you try to speak as layman's term as possible. So I explain to the patient, I say, imagine this is what I'm going to do, okay? I'm going to move your gums out of the way. And whenever I move your gums out of the way, I'm going to see a crater, a pothole. And then you pick a street near you that has tons of potholes. And I say, imagine for us, it'll be like in Houston, you'll say, Westheimer has a lot of potholes. So you'll say, there's potholes. Okay, so what do I want to do with that pothole? I want to fill the pothole, right? That's the bone defect. So we're going to fill this pothole, but before we do that, we're going to clean the pothole. And that means getting rid of all the bacteria, dead tissue, and so forth. We clean everything really nicely. Then I'm going to fill the pothole with bone. That's bone defect, and we're filling the bone defect up. And once I fill it with bone, I'm going to cover everything. Okay, and once I do that, then I'm going to put your gums right back. And what we're hoping for is for your bone, the pothole to fill in and heal very nicely. So that's, again, small analogies. I love analogies. I use the same thing for if we're going to do bone grafting for extractions. I say, once I take the tooth out, I have a hole, right? And imagine if I had a cup and I filled the cup with water and I came over your head and I turned the cup upside down. What would you hope I had on top? And they normally say a lid. I'm like, exactly. So the bone that's going to go in there, I'm going to put the lid, which is the membrane. So now they understand why I'm using this and why I'm charging this. Okay. And so that's, again, more analogies. The simpler you can talk to patients, the more they actually respect and appreciate the time you're taking to explain everything to them. Anybody can answer this question. How do you deal with patients after there've been a mistake, an accident, or let's just say, so you did something wrong as a dentist, right? We're not perfect. You do something wrong. How do you explain the mistake that happened to patient and still maintain the respect and or the appreciation that the patient still has for you? How do you maintain that, and how do you explain mistakes that happen?
Now, I would say I think it's one of those things where when it comes to dentistry, I don't know if I would call it a mistake per se, but I think kind of making sure you have a good informed consent situation beforehand, letting patients know, hey, we're looking to do this, but I see this kind of funny thing on the x-ray. I'm not sure which way it can go. So, for example, if there's a person who has a huge area of decay, but it's not quite into the nerve, I'm not sure what's going to happen, I'll tell them, hey, our goal is to just try to do a simple filling, but when I open up the tooth, I might open up Pandora's box. I might see like some ugly stuff. I will let you know as I see it. The other thing is, if I, see I need to do endo, like I tell patients before I start any endo, I say, hey, sometimes teeth lie to us on the x-rays and things are trickier than I think. I'm going to let you know that if I feel that your tooth is beyond my capability and when I get in there, I want to let you know there's a chance I might have you see the endodontist. Even when I extract teeth, I tell patients every time, I don't care what tooth it is, it's just now it's like I'm a broken record. I'm sure my assistant's tired of hearing me say it, but hey, just so you know, this can break. I want to let you know if it does, sometimes I'm able to get it out. If I can't, I will have you see the oral surgeon. I want to let you know there's a risk of that no matter what. So I kind of keep it so much across the board. It's like I almost like under promise to make sure I kind of temper their expectations, especially when it comes to removable. I tell them every patient when I'm getting into removal, I tell them every time, you're going to hate my guts. when I say it like that, they're looking at me like, huh? I'm like, yes. When you get this appliance, it's going to hurt. You're going to hate my guts. So these type of things can happen. And unfortunately, in dentistry, things happen. You can do a restoration and something breaks or a crown comes off. I do have a guarantee for certain things. So if a person has an issue with something within a certain period of time, depending on what it is, if they are my patient being actively treated by me and I did that work, then say if a crown has a problem within 5 years, they will have that crown covered at no cost to them because it should last longer than that. So, I think that also kind of helps with that as well. And, you let them know you do the best you can. That's all you can do.
Okay. When it comes to, oh, by the way, anybody who's a moderator, you guys can bring people up front. I'm not gonna lie, I'm too old for this, so I don't know how to do that. So if anybody wants to come up, please just invite them up so that they can talk and just join the conversation. Again, like I said, this is not a lecture. I want people to just come up and ask questions and add into the discussion. I know a few people that I'm already seeing. Hey, Crystal, what's going on?
Hey, how are you? Hi, everybody.
Thank you so much.
Who is here. Of course, my pleasure. I wanted to piggyback on Dr. Jackson. She said some awesome things, and I just wanted to kind of remind everybody that there are no guarantees in the whole body. Medicine doesn't have any guarantees, and so we sometimes as dentists think we are, like machinists, and things are meant to work. We cut something out and we put something in and it's supposed to stay the same way, but the body is a body that includes the teeth. So being able to, like Dr. Jackson said, preempt, let them know that things may go wrong, but then also, keep in mind that everybody's bite is different. Everybody's the way they breathe is different. The way that their bones are, either resorbing or not resorbing, their health. So different things play a factor. The mouth is not a silo, so it's connected to a lot of things. So we have to remember that some of the errors, quote unquote errors, that occur in dentistry are not necessarily iatrogenic, as we learned in dental school. Definitely, if you make a mistake, you want to preempt and talk to the patient when that happens, and you don't want to lie about anything. But part of it too is just saying, hey, this is part of the body, and your bite is different. The different things that can occur. You could be grind off that crown, and it's gonna, we're having to re-cement it 3-4 times, and we shouldn't have to, right? So, I just wanted to add that 2 cents in there, so we dentists too, we can feel like it's not always, because I know we beat ourselves up. So it's something to actually start thinking about as providers and healthcare professionals. That's all.
Can you explain what iatrogenic dentistry is?
Well, iatrogenic, we learn just things that are caused by us. So say, if it's a crown or something like that, a PFM, you didn't take off enough tooth structure for the height. I forget all the words. I don't do crowns as much anymore, but or if the margins aren't proper, or if you've, kind of done a filling that you didn't really have your class 2, your things, and you didn't bond well, certain things like that that occur on an everyday basis that is caused by, mistakes by the dentist, so to speak.
You explained it way better than I would have, so that's good. Actually, that makes a lot of sense. While I have you up here, can I ask you something? So, Dr. Dean is a pediatric dentist who has been really doing a lot of nuanced things with sleep apnea for kids. And again, correct me if I'm wrong at any time, Crystal, but sleep apnea for kids, and a lot of people don't talk about that with kids and what are the issues that could happen. So as a parent, I come to you and, my kid might be a little bit overweight. We're thinking, oh, that's just, baby fat and other factors. Can you explain to any of these students or anybody that's listening, how do you relay that information that no, there's actually a pathology which might be sleep apnea or the way their bite is or so forth. Can you explain that to us and how you basically get parents to understand what's actually happening to their child?
Yes.
I mean, that's a loaded question, so
it's
just as simple as you can.
It'd take a couple hours, but yeah, to explain to parents, since it's a newer area, for most dentists, most pediatricians, most everybody, to be honest, unless you've gotten a lot of the training, it is something where this chairside manner is very, very important, because it's really not even about sleep apnea. Sleep apnea is the end stage. Any kind of breathing disorder, even breathing through the mouth, which all of our patients do a lot of that, fighting with the tongue, so that, tethered oral tissues, things like that, things that we learned about in embryology and histology and physiology, but we didn't, and anatomy, and we didn't pay attention. And these things can be seen from 2 days old in a child. So when you're talking to a parent, you first don't want to say, your child, because you can tell by the face. You can tell by the face, the sunken eyes, the chapped lips, things that were like, oh yeah, they're just wearing chapstick all the time. No, they're breathing through their mouth. The grinding of the teeth, the flattened out, like no mamelons available. They're getting headaches at this age. Even 7-8-year-olds are getting headaches. We're not supposed to get headaches. We're not even supposed to really get migraines. And there's physiology behind that, or they're just overactive, things like that. So a lot of times our parents, or for this example that you gave, you want to just really start off asking a lot of questions. Being more curious than just saying, look, I see your child, he's overweight, so that means we have a nutritional issue, a nutrition problem, processed foods, different things like that are attacking the body in the wrong way, causing a lot of inflammation. You don't want to say, I see his face, I see the mouth is open, while we're even talking, or while he's watching TV. He's got narrow maxilla, no space in his mouth for his teeth. There's a lot of crowd. You don't want to start off saying any of that. You want to start off asking a lot of questions, because a lot of times the parents are going to tell you a lot of things, even from birth. A lot of our questionnaire have questions about birth history, how they were born, things like that. So you ask the question, the parent starts to get a little bit more curious, and they're like, wait, I'm at the dentist. Why are they talking about anything other than my child's mouth? And so they're getting curious, but they're answering the questions. And then some of the things where the parents are like, I didn't realize that had to do with that, or this had to do with that. He's always active, or it's so hard to wake him up in the morning. I thought he was just being a badass. And really, they're not. A lot of kids don't know how to tell you that they're, and they're not necessarily suffering from sleep apnea, but they're suffering from upper airway resistance, right? They're unable because there's some structural issues, functional issues with the tongue, things like that aren't working as well. And so that's just causing a cascade of events, and the things that we see are like the symptoms. And so when it comes to like integrating like pediatric dentistry to airway and to sleep with parents and with parents of young kids and things like that, you really have to be very curious first. Then you have to do a lot of educating and just kind of say, yeah, there is a relationship. Some things you may not have seen, or even your pediatrician, which is fine because they're looking for lumps, bumps, inflammation. So that's the teamwork. The thing about pediatric dentists, we see the patients twice a year for over 45 minutes most times, and we're looking at them. We're actually we're hearing them, we're looking at them, we're working on them. So we actually see them a little bit more than sometimes a pediatrician will see them unless they're sick. And the goal is not to see a child when they're sick. That's symptomatic. That's palliative, because other things are going on because the body's talking. So that's a roundabout way of answering your question. But you just stay curious. You stay as curious as possible. Ask a lot of questions through, obviously, your knowledge. You start learning how to ask questions about how they sleep. Are they waking up in the morning? Does the bed look like a tornado in the morning, right? Are they tossing and turning? Can you hear them grinding their teeth? And you just don't know why. You think they're stressed. They're not paying bills. what they stress about, So, and there's other ways that their body is stressed. It's not them stressed. It's hard for them to handle what's happening in their environment, and it's hard for them to describe what's happening in their environment because their body is stressed. So their autonomics are off the wall. So that's when you start to go into some of that stuff after you ask some questions, and then you educate a little bit, a lot of it. And it sometimes takes 2 or 3 visits, and the parents start to see, and they start to see the relationships between that upper, the mouth, the face literally is what we deal with. The mouth is part of the airway. So there's a lot to it, but I hope I answered the question.
You did. This question goes out to any and everybody that wants to answer this. So right now we're dealing with a lot of issues in the U.S. and around the world when it comes to unemployment and so forth. So how do you talk to patients when their treatment plan is a lot? I mean, it's overwhelming to them. They come in and they think they're just coming in for a cleaning, and then you notice you have multiple cavities here. You have they need crowns, they need fillings, might need a tooth taken out. How do you talk to a patient about their big comprehensive treatment plan when they just thought they were coming in for a regular cleaning?
If anyone wants to interrupt me, please feel free. But I'm a big fan of telling patients everything you see, meaning like, okay, I see some concerning areas on here, there, whatever. And then I kind of try to break the treatment plan into what is most urgent and kind of go from there. So I tell patients whatever can, almost like, at least I don't know about you guys, but this is kind of how we went through things with treatment planning in dental school. Whatever is most urgent, meaning can it cause infection, pain, stop you from functioning, we want to take care of that first. And we, understand that since COVID hit, a lot of people have lost their jobs. And as a result, we actually put on the bill in the office, hey, if you're having an issue, please let us know. Although we don't really send out too many bills, but we put that on there. And we've spoken to patients about it because some people have lost their jobs or lost their benefits, or I only have benefits out of the month. So my focus is, let's make sure we do something so you don't wake up in the middle of the night one night and have, severe pain or stop you from sleeping, and then explain from there, hey, these are the things, let me do the largest area of decay to the smallest if that is a concern. As far as restoring missing teeth, that's something that's not as urgent. So yes, I think a filling is more urgent than replacing missing teeth. I tell them, hey, that component can wait. The rest we can do piecemeal, and but you have to let the patients know what's going on. You can't do that because that's being negligent otherwise. But unfortunately, there are going to be situations and times where you can't cater to everybody. I have had scenarios where I've had a patient who's been long-standing. They've been with me for a long time. I had one patient who lost her job. She had one cavity. She usually didn't have anything. So you know what? Let's take care of this. We'll hold off on charging anything until you're back on your feet with a new job. And she ended up getting a new one within I think 8 weeks, paid everything in full. But it was very, very, very exceptional, circumstantial type of thing. So I think it's important as a practitioner to pick and choose that, accordingly. I don't recommend that for everybody in all cases, but, you can't survive in a business or in any situation just giving everything away either.
Anybody else want to contribute, or can I do a follow-up question? Okay.
I was just going to say, in addition to that, also making sure that you have other options for parents or for your patients when it comes to paying for treatment, because there are a lot of different ways. I know, especially people who are practice owners, you can have in-house financing up to certain amounts for, certain things, care credit, different things like that to kind of help the patients out, especially in a time like what you were saying, Doc, that people are going through extra critical financial situations. So just giving them more options too.
I want to add something to Dr. Hardy. Thank you for saying that. One of the things I've done recently with patients, and I've done this in the past, I've not I don't think this is for everybody, but I am not with every insurance plan. So I've had, especially recently, some patients who have either lost their job and have either like a state insurance or something different. And they'll say, "You're not in my plan anymore. What do I do?" And I have told patients, I want you to get care. I want to make sure you're in good hands. And unfortunately, I know a lot of people in the area. And I will tell the patient, take a screenshot of your providers that are close to you in your plan, email it to us. I will tell you who I know and who you'll be in good hands with. And there are some people I know who work at say some of the local health clinics who are great providers. That's just, they work in a different setting than me. And I say, hey, go see Dr. Robinson. She's great. I know her. I went to school with her. You'll love her. You'll be in good hands. I know you'll be taken care of. And patients appreciate that. And I've found doing that over the years, when something comes up and they are able to get a different plan, they come right on back. But you want to make sure, the idea is you're taking care of people.
One thing that I kind of want to add on to that is, I'm not sure if you guys have heard analysis paralysis, but given too many options sometimes can also backfire on you. If you tell a patient there's like 50 million ways to do something, they're just going to be frozen and go, I don't know what to do. I don't know how to pick. I don't know what to pick. So I think honing down and saying these are your three options or whatever it may be, and these are the best ones, and explaining to them the difference between that, I think would also benefit them a lot versus just saying, because again, as dentists, sometimes we kind of overanalyze. And I think that that's something that we need to be careful of, just making sure you just keep it simple, explain to them these are your options, but don't overwhelm them with too many options. Or if you have a treatment plan that's tremendous or a large amount of treatment plan, just start off and say, hey, let's just start off with this area. Well, let's start off with something like a deep cleaning, and then we'll progress as we go along. Even that allows patients to just not feel overwhelmed. And again, correct me if I'm wrong, anybody, but I feel like that's the best way to kind of get patients to kind of come along with you for this ride of yours, because you're going to be seeing this patient for a very long time, and you want to make sure that you sustain them and get them going in the right direction. What do you guys do when the patient only cares about, the front teeth, and they have missing teeth in the back, or they have, blown out cavities in the back, and they're really not worried about that? They're like, well, I just want my teeth whitened, or whatever it may be.
I say, peace out. No, I don't say it in those words, but I tell them, hey, we're definitely able to get to that. But right now, I'm afraid you're going to wake up and, your face is going to be swollen out to the wall. I tell them, I cannot do this in good faith without taking care of this issue first. And, I found over the years, people aren't too, they don't really push back on it. I don't fight them. I just tell them, I have to inform them that it's my duty to let you know you can be in severe pain. And I would be at fault if I just let you go about your day with whatever. Now, there are certain circumstances where if something is coming up and they have something broken in the front, it's maybe usually wouldn't have been as urgent to do versus a blown out tooth in the back to be extracted. But I, for example, I have a patient who's a makeup artist who has a lot of media appearances, and she has some periodontal issues. They're going to be taken care of, but she has a peg lateral where she was actually turning down jobs. And so I said, look, we'll build this up. I would not do this ideally, but in this circumstance, in the day and age of COVID where you need work, I'm going to do a little bonding on here so at least you can feel comfortable, in front of the camera. I usually will not do this, so there are circumstances that dictate that, and you document that. And I don't want her to not be able to put food on her table, because then she still can't come to me. But something that's very, very minimally invasive or small, I feel comfortable doing, versus ignoring everything, else and slapping on some veneers. Meanwhile, the person doesn't have half their bite there. That, that just is, that's crazy stuff.
Okay, well, you actually just made me think of something. And this goes for every doctor that's up here. How do you dismiss patients from your office? Let's just say it's just not a proper fit. How do you dismiss patients from your office, and how do you handle that? We'll start with Dr. Hardy.
I usually make sure I have the conversation as soon as I've decided that they're not going to be a good fit for me. So it's not coming as a huge surprise. But usually when you dismiss a patient from your practice, it's usually a particular event or a particular reason why you've done this. Or they're consistently doing something that's going against, what I would like to practice as a dentist or things like that. For instance, I only will go so far when it comes to parents or people who are completely against x-rays, and I'm starting to see that their child is a little bit more high caries risk. I'm not going to continue to treat you years and years down the line, because that puts me at risk as a practitioner, because I've never been able to fully diagnose what's going on with you. And I still want to do comprehensive care for you. So usually what I'll do is, once it gets to a certain point and we've had a conversation, like, this is what I believe as a professional. I understand, these may be your beliefs. I just may not be the right office or the right fit for you. So I will give you a referral to, these are some other options for some other dentists in the area that you may want to, get another opinion about, or get a second opinion on. I'm really big allowing parents to have second opinions, because a lot of times, one, they end up coming right back to you, because usually it's not something too off the wall that I would, be recommending. But also it makes them feel comfortable that you're not just trying to push your agenda on them. You're actually still giving them a little bit of an opportunity to have autonomy over what they think is right, because at the end of the day, it's their body, their treatment, their child. So ultimately it is up to them. But I always make sure to have that conversation as soon as I know that that's going to be a decision that's made. And that way, when they get the letter in the mail or whatever, then it's not really coming as a surprise.
Dr. Jackson.
You know what? I haven't had to dismiss too many people recently, but we have a rule in my office: 3 no-shows, you got to go. So I apologize if there's background noise, guys. I'm driving right now, but I think about a patient I had who, paid a portion of his crown, no-showed once, no-showed twice, and a third time, and so we refunded him what he had already paid towards it, although we did charge the no-show fee. And we dismissed him. And in our letter, we specify what's what, and we'll provide emergency care for up to XYZ number of days. And he went to another practitioner. That practitioner is actually a friend of mine in the area, and so I told her, I said, hey, just FYI, he's kind of has a poor track record of actually showing up, just so you know. But so that's one thing I have routinely dismissed patients for. I haven't had too many others I've had to dismiss. Once in a while, you may run into someone who acts real ratchet, and they can't, you can't be up in my office yelling. I don't yell at all. So you are not to yell at staff. I treat my staff like family, like my whole team, like those are my girls. We don't do that yelling thing. And I had a patient, I had to tell her, I said, excuse me, with all due respect, we don't yell here. And she got a little funky with me. And, she finished her treatment that day. I said, I don't know if I'm the provider for you, and we sent her a letter. That was that. But so it wasn't a surprise. It's very seldom you'll have to do that. And this is one of those things where I think it was Dr. Hardy who mentioned, somebody who's declining certain things. There are, with adults, it's a little bit different. Kids, it's like child abuse if they're not taken care of, certain issues. But with adults, you can say, I have said to patients, you're welcome to have a second opinion elsewhere. This is what needs to be done. And we go from there. But usually, even if they do, they come on back. It's just about treating them right to begin with, so they will come back.
Dr. Crystal.
Oh, I was just going to agree with both Dr. Hardy and both Dr. And Dr. Jackson. I mean, essentially, it's a relationship, and so both parties have to respect each other, and that's just that. We can't chase the money. We have to chase. We have our own mental capacities and mental health that we have to look after as well. So there's some patients, and they always come back. So We have the right to choose who we treat, just like they have the right to choose who they see. So.
I completely agree. So there's a lot of things going on in dentistry that changes every year, and the biggest thing that I've seen so far is holistic dentistry. I remember a few years ago when I was a general dentist, I had a patient come to me saying they wanted all their mercury fillings, amalgam fillings, out of their mouth. Nothing wrong with them. Nothing wrong with the amalgam filling. Nothing wrong with the teeth at all, but they wanted it all done because they said that the amalgam was actually poison in them. And I personally didn't understand because, again, the literature didn't support that at all. And I'm not saying that that's not the case. I'm not saying that they're not allergic to metal. I'm not saying any of that stuff. But to me, I couldn't do it. Right. Other people talk about ozone treatment and so forth. And there's like a whole branch of dentistry that's opening up now. So how do we talk to patients about holistic dentistry? And if you agree with holistic dentistry, please educate us. But how do you talk to patients about holistic dentistry and some of the nuance and treatments that they want when you just don't believe in it? Anybody can pick up on this.
I'm gonna add a couple things as far as we treat holistically, like WHO or WHO, not holistically, because there has to be a marry between. Hello. Oh, sorry. I don't know how to use this thing that well. There has to be a good marry between, obviously, evidence-based dentistry and also realizing some of the things that we use are toxic. So finding new alternatives to being able to treat, bacteria, essentially, is what we're doing, and remineralize the teeth. So I think the downfall is that people go to Dr. Google, and sometimes you want to give them that option, but it's the onus is on us to continually stay educated on, because there's a lot of research coming out, like very what do you call it? Just really good systematic research that's coming out that's able to verify some of these things, but we owe it to our patients to just stay on top of it. How do we kind of combat or talk to patients? You give that's the option that they can get, right? They can get those options. You just say, at my practice, I practice, something that's been working for however long, and you go about it in the way that you do. But then also on top of that, you just continually stay on top of just how everything works within the body, the system. And that's why I talk about treating holistically versus just like the HO, holistically, right? Because you got to marry there's a reason for medicine, but there's not a reason for prescribing all the time or using certain chemicals or what have you. So that's essentially my 2 cents on it. I'm not like a proponent. I'm more of I understand what it's doing within the body. So
awesome.
And the cost and benefit, actually. Yeah.
All right. Anybody else want to chime in? Okay. Well, the last question I have is basically, a lot we're getting to an area where these kids are gonna be starting dental school, pre-dental, or they're applying for dental school and so forth, and so they're gonna actually have to talk to their first patient. They're gonna be the provider, and I mean, I remember when it was me in dental school, I was very excited. Even if it was just a pro fee, I was excited to see the patient, be their dentist, and treat them. That's something that you just can't take away from anybody. So what advice would you guys give to these young and up and coming dental students about how do you develop a bond with a patient? How do you treat a patient when you're sitting face to face with the patient? How do you make sure that you capture their attention and also make sure that they want to be treated by you? And any advice that you can give to the students would be really appreciated right now.
I say start off being friendly, just sometimes I think when we're in the rigmarole of day in and day out, we don't think about little details like, hey, good morning, how are you? If it's your first time seeing them, after you've gone through everything, explain everything, make sure they have any questions answered, and also tell them, it's a pleasure taking care of you today. Just saying that makes a person feel that they're cared for, that you're trustworthy. In addition to that, as you treat a patient more, even on the clinic floor as, a student, you learn about the patient. So I'm a foodie. I likes to eat. And so patients know me for knowing all the local restaurants and knowing I know all the foods and stuff. But I tell people, one of the things you can easily bond with most people over is some type of food. So, if a patient has a lot of cavities, you might be talking about what snacks they have. Look, goldfish are really bad for your teeth because they sit up in the grooves. I like them anyway, but I tell patients, hey, that type of stuff. Little things like that. You don't necessarily want to go into politics, but like, food, sports, that type of thing is really easy to kind of connect to people with, and just remembering little things. If it's their birthday, oh, how was your birthday? Or, how was this? How was that? Those little kind of day in and day out, almost small talk type of things are a good way to kind of connect to people.
Anybody else want to answer this question?
I was just going to kind of piggyback on what Dr. Jackson said. I definitely, especially with pedo, remembering those little small things about your patient can be difficult to do if you see a lot of patients in one day. But if you just take the time I would put it in my chart. I know in pedo, a lot of times we have a whole section where we describe the patient's behavior. In those areas, I would write little things like, is going on, going to Africa with their family to visit, and I would just put a quick little note. So when I look at the note from before and I'm introducing and talking to the mom or the parents or whatever, I can mention that, and it makes them feel so much more connected. And then also you feel more connected, because I think one thing about being genuine is doing things that just kind of make sense and become a little bit more routine. So having that small talk won't feel as forced. If you're like, oh, hey, I remember you were reading the Harry Potter book series. How did that go? Or, whatever they're reading now. I think those small talk things definitely help. And I would also probably say to always be yourself. Just like Dr. Jackson said, if you're enthusiastic about being a foodie, or like someone like me, I'm really big on like reading a lot of books and stuff. If those are things that you enjoy, those are easy, genuine, small talk conversations that you can have, and that it does not feel forced. The last piece of advice I would say is to actually listen to your patients. And it sounds so simple of a concept, but a lot of times we get stuck in the idea of I've got all these other patients waiting. I got to make sure I get done in here. You're kind of going through what your steps and what you're going to do with your patient before you even get into the room most of the time. So you don't ever want to get into the habit of where you feel like you're rushing the appointment because it seems like you are careless and it seems disingenuous again. So you always want to make sure that you are systematically approaching things, because then you can get through all your important points in the conversation, make sure you're asking all the questions you need to ask. But then also you don't feel like you're rushing or feeling, forgetful. So I take a more systematic approach. Like when I walk into the room, because sometimes I'll have parents that I've met 2 times and I don't remember that I met them, but they remember that they met me. The way I introduce myself is like, it's good to see you again, because I'm genuinely have parents upset at me when I don't remember who they are, or if I don't remember the child's name. So just becoming systematic of those little details makes it a lot easier to continue to be genuine, and you don't feel rushed and overwhelmed, even though the rest of the office is rushed and overwhelmed and chaotic. You can still make that patient really feel like you're devoting all your care and attention to them, because you are in that moment. And then also, I always look at it like I want to give every patient I have a sense of excellence, like a sense of I've given you my absolute best. I'm grateful that you even came to see me. So continuing to stay humble is another thing. And that just goes just in life in general. But not having the era of where I'm the doctor, you gonna listen to me. Cause, even though sometimes, yes, we know what we're talking about, you still want to be humble and say, okay, well, these are the scientific facts. These are the things that, from a professional opinion, this is what should happen. But I understand you feel this way. Then figure out how you can meet in the middle. But definitely remembering to stay humble is something that's very important, because people like to know that you're a regular person and you're just doing your job. So
Alexa,
being as genuine,
stop.
as humble, and as attentive you can in a systematic way, I think makes it so much easier. So you don't have to feel like you're forcing conversation or feel like you're struggling just to smile and look at people. Because some days in dentistry, that's how you feel. Like, I don't want to smile and laugh with these kids, but those kids had nothing to do with what happened with your last patient, or you having a headache today, or you being behind on schedule. They don't care nothing about that. They're here for their experience and their experience only. So, yeah, that was my 2 cents.
Dr. Crystal.
Oh, Dr. Hardy and Dr. Jackson just hit it out the park. That was that was a real thing, especially in pediatrics. And also just kind of remembering a lot of these patients, the parents, the kids, even in general dentistry, they don't really have a lot of people to talk to. So sometimes it's really the smallest things, and like all the practitioners have been saying, just listening, with obviously your schedule in mind, though. Sometimes you can get out of control because you're just spending a lot of time. But just realizing, like it's been said before, the small things. And I do the same thing. I keep a note in my very short one, because it's supposed to be clinical, but in pediatrics it's very helpful to remember who went on what Disney trip. So just staying as personable as possible, and like it was said before, forget the last patient. That's like our superpower, because the last patient can be something that you really just want to go home, but you have a duty. So remembering a sense of duty that you have for these patients is important. So that's it.
All right, I'll end it off here by saying, everything you guys said is, 100% correct. One thing there's a few things I would add, would be whenever you come into the room, don't just jump into treatment plan. Don't jump into dentistry. Just like you said, hey, crack a joke. If you're funny like I am, make sure you crack a joke. Make sure that they just kind of relax a little bit and get to, just settle down, because you're probably anxious to be in that chair, right? Because you don't realize how much of an authority figure you have over the patient. Sit down, grab a chair, sit down, so and bring the patient up. So now you're face to face, eye to eye with the patient, explaining things to them. Another thing is, don't turn your back. We have the tendency to want to point to the screen with our back turned to the patient. Make sure that you're still facing the patient and explaining to them. So you're both going through the journey together and explaining everything, using analogies, using figures, using models, whatever you may do. Just make sure that you're now connected with the patient one-on-one. Don't stand over them, because standing over them doesn't help anybody. And they might not even listen to what you're saying. Have them repeat some of the stuff back to you, so that you know that they understood. And then one thing I always say to everybody is, did I explain everything well? If I can say that and they can honestly tell me, yeah, I get it, or no, I don't understand this, then go over that again. But make sure that hey, did I explain everything well to you? Yes, no? Okay, cool. Thank you so much for coming through. And just be yourself. People know when you're being fake. Just be completely yourself. If like I said, if you like certain things, and Dr. Jackson said it best, if you're a foodie, talk about food. Talk about things that are around you. Talk about things that interest you. Talk about something that interests them. Don't be just all about yourself either. So I feel like that's it. And hopefully we got a chance to answer everybody's questions, if they have questions. Thank you guys. Honestly, thank the group for allowing us to come up and talking to this group. And we definitely appreciate everything that you guys are doing with pre-dental. And I really believe that everybody's going to do very well and very, very, very successful. And we'll all be colleagues one day, very, very soon.
Thank you all as well. or let me crash.
I'm going to copy and say same. Thank you.
Yep, I did all of that. Thank you, everybody, and thanks for coming up, Crystal, too. I think it's been very informative, and thank you, Dr. Aka, for leading this discussion because you had some great questions.
I just get annoying once in a while.
It was my pleasure.
Well, thank you all for joining. This is a discussion by Future Minority Dentists on Clubhouse. Please don't forget to become a member of our club. We have discussions every Monday, Wednesday, Friday, and sometimes Saturday. And we will definitely invite everyone on stage back for our next event. I can't wait for this to continue going on. Thank you, Dr. Aka, for just doing what you do for me and for the rest of this group. We will hopefully see you guys on Wednesday, if not Friday. And we hope that you have a great rest of your evening. See you guys.